I will start with her in the mid-phase restoration with Juvederm Voluma. As I mentioned before, this is the perfect product to restore volume, and due to its biophysical properties, it very naturally integrates with the surrounding tissue, while at the same time providing a very good support to these structures that tend to sag down, and has a very good durability and lasts for a long time. So I start, if you look at the mid-phase zygomatic arch as an arch, I start at the highest point of projection because I want to achieve a good support to the medial part and also to have a lifting effect on the lower part of this mid-phase fat pad and gaining redefinition in the jawline. I tend to shift the tissue a little bit up, push my finger against the zygomatic arch and inject perpendicularly just until I reach the periosteum. And as we have a good supporting bone structure underneath, it doesn't take much volume. It's more like creating a little pillar that lifts the overlaying tissue above and perfectly provides support, and that results already in a little bit of lifting effect even in the lower part of the cheek down to the jawline. That was not painful at all. No. You could see her that she was not even blinking with her eye. So the second point, again staying on the zygomatic arch away from the direct under eye area, injecting directly supraperiosteally 0.1 cc, 0.1 ml Juvederm Voluma per injection point. Already after having injected these 2 points, seeing her in the light, you can tell that the light reflection improves already, which is what patients see when they look themselves in the mirror, because this loss of volume in the mid-phase leads to slight indentations which does not reflect the light anymore, and that gives them an instantly refreshed look. Compared to the untreated side, you can, after these 2 injection points, already see that the support that we gave in the lateral part of the cheekbone here stretches the excess skin in the lower eyelid and improves already the expansion of the tear trough on the cheek. So we have shortened the virtual tear trough by just indirectly by supporting the bone structures in the mid-face. So we inject again perpendicularly, again 0.1 cc, and you can clearly see that with this last point specifically, she has significantly improved also in the lower eyelid tear trough area, which then leads also to less shadowing and less dark impression of the lower face. And we have a little lifting effect in the cheek area that smoothes the transition from the nasolabial area into the cheek.